Good morning. This is my first trip to China, and it's a great pleasure to be here in Hangzhou together with you. Thank you for this opportunity to share with you my understanding of key elements of the Israeli healthcare system. Over the past 30 years, I have been extensively involved in cross-national learning in healthcare, mostly between Israel and the United States, and secondarily between Israel and Europe. This has entailed writing papers together with people from other countries, organizing binational symposia, and planning study visits. I am delighted to have this opportunity to begin to interact with Chinese business and healthcare professionals. I hope it will be the first of many such interactions, both here in China and in Israel. My talk has three main components. First, I'll give you an overview of Israeli healthcare system, and I'll talk about the four key structural elements. Then I'll share with you some selective comparative statistics which underscore the efficiency of the Israeli healthcare system. And then I'll identify what I consider to be 7 vital ingredients which contribute to the efficiency of Israeli healthcare. So first, the overview. One of the key components of the system is that we have universal insurance coverage. All Israeli citizens are covered through a government-run national health insurance program. The government also specifies the list of services to which all citizens are entitled. This is called the benefits package. This system was put into place in 1995, approximately 20 years ago. Second, the system is financed primarily via progressive taxation. Those who earn more pay more. The monies are raised via the income tax and via a special health tax, both of which are progressive. That means that the higher the income level, the higher is the proportion of income paid in the tax. Not just do the rich pay more, they pay a higher percentage. The third key building block is that care is provided through 4 competing nonprofit health plans. Even though the government is the ones to collect the money, the government does not itself directly provide the care. Instead, the care is provided through 4 large non-governmental organizations, which we call health plans. Each citizen is free to choose from among the 4 plans and to switch plans whenever he or she wants to do so. The government takes the monies that were raised for health insurance through the tax system and distributes those monies among the health plan based on how many people joined each health plan and their age mix. The health plans get more money from members who are elderly than from members who are working age, even though, in general, the working age members paid more money into the system through taxes. The health plans are then responsible for making sure that all their members have access to all the services that the government has determined as being in the benefits package. The health plans can provide the services themselves or pay some other organization to provide the services. So, for example, they might buy some of the services from a hospital owned by somebody else. The health plans are big, well-run, and very efficient organizations. They range in size from almost 1 million members to 4 million members. They are hierarchical organizations with national, regional, district, and clinic level management. And this enables them to combine strategic direction from the top with a lot of room for innovation at the local level. The fourth key structural element is that we have a mix of governmental and non-governmental hospitals. About half of the acute care beds are owned by the government, about 1/3 by the health plans, and the rest by a mix of smaller nonprofit and for-profit organizations. So I'll just review those 4 structural elements. We have universal insurance coverage. Financing is by way of progressive taxation. The care is provided by way of 4 competing nonprofit health plans, and we have a mix of governmental and non-governmental ownership of hospitals. Now a few statistics. Israeli healthcare is considered to be among the most efficient in the world. And where we come out exactly in the rankings depends on how the rankings are being done and what year they're being done, but in general you come out towards the top. For example, in the latest Bloomberg ratings, Israel came in third, behind Hong Kong and Singapore, and just ahead of Spain and South Korea. The next set of slides will illustrate the statistics that contribute to this high efficiency ranking. In this slide, we see that in Israel, the share of GDP accounted for by healthcare is much lower than the US, and it's also lower than that of the UK and Japan. As we see in the next slide, the difference in dollar terms is even greater. Nonetheless, life expectancy in Israel is the second highest of the 4 countries shown here. Israel also looks good comparatively on other key health statistics, health status measures, such as infant mortality. This raises the question, how does Israel achieve such good outcomes at relatively low cost? I'll be sharing with you what I consider to be 7 vital ingredients that have contributed to Israel's efficiency in healthcare. The first is a combination of centralized government financing with non-governmental delivery. The centralized financing makes it possible for Israel as a society, through its government, to decide how much it wants to spend in healthcare overall. It can cap the total spending level. It can also prioritize and figure out how it wants to use that money. Every year, there are so many new medications on the market, so many new technologies. No country can afford all of them. Certainly in Israel, we can't afford all of them. So government puts into place a centralized process for reviewing the pros and cons, the costs and benefits of each new technology, deciding how much we can spend on new technologies, and then figuring out which of the many new technologies we will actually add to our benefits package. So these are benefits of centralized financing. But we also have the benefits of non-governmental delivery. Many different providers without the constraints of government provision. They have the initiative, the energy, and creativity at the delivery level. Second vital ingredient. Even when it comes to delivery, the market is not left on its own. It's not that every provider can decide on their own to do what they want. There's a framework, regulation. So, for example, the government will decide which services will be provided as part of the national health insurance system. But then it leaves to the health plans to decide how they'll provide those services, which services to make themselves and which to buy from others, what mix of health professionals to employ, and so on. The third vital ingredient is being a leader in the effective use of health information technologies. It begins with the fact that in Israel, all primary care physicians have on their desk electronic health records system, which was developed by their health plans. They didn't each one have to develop their own system. Moreover, and increasingly, the information from the health plans is linked up with the information from the hospitals through what's known as a health information exchange. That means that, for example, if a patient comes unconscious to the emergency room, when the emergency room physician wants to treat him, he can check through the computer what medications the patient is allergic to and avoid giving them to that patient. The latest trend in Israel is more and more member and patient portals, so that the patients themselves can, through the internet, make their appointments, view their test results, communicate with their providers through a secure personal health account. And related to that is video conferencing, so that the elderly patient who has trouble leaving their home can interact visually with a nurse sitting at the health plan facility, and she can both see how he is doing and his symptoms, and also give training and guidance visually, not just orally. Now, with all this, there's an important synergy between our Israeli technology companies, our high-tech companies who are involved in in the digital health area with our healthcare providers. Through our healthcare providers, they can understand better the needs, where information technology can play a role, and then go back to their laboratories, offices, and figure out solutions. And similarly, because Israel has such a vibrant, high-tech community with so many new ideas, Israeli healthcare benefits from having the opportunity to have early exposure and adoption of those new developments. Our fourth vital ingredient is a strong primary care system. We have very broad geographic coverage so that almost everybody lives pretty close to a primary care provider. We also have very short waiting times. In fact, the OECD came in and took a critical look at primary care, at the Israeli health system, and said that its primary care system is among the best in the world. We have a well-trained, well-organized, and reasonably well-paid cadre of primary care physicians. The fifth vital ingredient is an ability to set strategic goals and mobilize accordingly. Sometimes this is done through top-down direction by the government, but most often it's a voluntary, coordinated effort between government and the non-governmental providers. So, for example, when a decade ago we understood that we needed to improve quality of care in the community, the health plans, the research community, and the government got together and worked on a system for measuring quality in a consistent way and developing tools that will help improve quality. This same kind of coordinated response also takes place when we have to deal with disease outbreaks and other health system challenges. The sixth vital ingredient is an alignment of incentives. Because our physicians are paid on a salary basis, they and the health plans for whom they work have the same incentives to provide high quality of care, good levels of service, but also to be mindful of costs. This is quite different from the situation, let's say, in the US, where while the organizations might have an incentive to control costs, the physicians are paid fee for service and have an incentive to provide more and more care. And seventh, and perhaps one of the most important, we in Israel have an ability to adapt innovations from other countries. This is, again, quite different from the US. As I mentioned, I grew up in the US. I lived there for the first 30 years of my life. And there was an approach that we're so different from the rest of the world. We can't really learn from other countries. Their health systems are so different. Now, maybe that's improved a little bit in the US, but then there was an attitude that we're a big country. Well, we can't know ourselves in Massachusetts. We can learn from California and vice versa. When I moved to Israel, I found something completely different. People were always asking themselves, how do they do it in other countries? What's happening in Denmark? How are they doing it in India? And traveling to other countries to see those models themselves, to confer with people and encouraging people from other countries to come to Israel to tell them. I've been, for the last half a year, collecting stories from Israeli healthcare leaders and asking them about examples of adaptations such as these from other countries in which they were personally involved. And almost every healthcare leader has a story like this in which he was personally involved. In fact, some of the most important developments in Israeli healthcare were modeled on developments in other countries. Now, of course, we don't just take what's done elsewhere and do a copy-paste, because what worked in Hungary isn't going to work exactly the same way in Israel. And what worked in the US, probably we can't afford it in Israel. So we make adaptations. Sometimes we figure out how to do it cheaper, and sometimes we figure out how to do it better, because we, for example, have better electronic health records. So we can sometimes do things which were in the US were based on paper records. We can do it even better because of electronic records. And what enables us to do all this is our combination of humility and what we call in Israel chutzpah, which sort of means boldness. That we have the humility to realize that we can't do it all on our own. We need to learn from others. But the chutzpah, the boldness, to be able to say to ourselves that we know our own system the best of anybody. Even if we take the general idea from elsewhere, we can play a role in adapting it so it works as well as possible in our own system. This slide summarizes the 7 vital ingredients that I've discussed: a combination of centralized government financing and non-governmental delivery, a combination of competition and regulation, leadership in the effective use of health IT, a strong system of primary care, an ability to set strategic strategic goals and mobilize accordingly, alignment of incentives, and an ability to adapt innovations from other countries. These are some of Israel's special ingredients. As I stand here with you in Hangzhou, I'm curious, what are the Chinese health system's special ingredients? What are its special strengths? I hope that later today, and in the weeks and months ahead, some of you will reach out to me and share your perceptions of Chinese healthcare's special strengths. Now, in addition to directing a Health Policy Research Center, I'm also a journal editor. And our journal is dedicated to exploring what Israel can learn from other countries and what other countries can learn from Israel. I'm pleased to report that we recently published our first contribution from China, which you see here on this slide. And we look forward to many more such contributions from China in the years ahead. Thank you very much.